I repeat, I was saying today we're going to look at a topic called ethics in clinical practice. This is under communication skills and medical ethics. Okay, so to begin with, we're going to look at a topic called clinical ethics, the definition, and then the principles. Okay, so clinical ethics refer to a practical discipline that provides a structured approach to assist health professionals in identifying, analyzing, and resolving ethical issues in clinical practice. What this means is that as one practices medicine, sometimes they may be faced with a moral dilemma in which one is required to solve a difficult problem in real life. For instance, an issue to do with a patient that is not happy. Or let me give an example of a surgeon. If at all your ethics state that before you operate on someone, there's a payment that must be done, it means that ethics in this case will have you to get the amount of money from them before you can actually conduct the surgery. Okay, so what we're saying is that under clinical ethics, we are talking about rules and regulations that can help a clinical officer in this case to identify, analyze, and resolve any ethical problems or issues that may arise in clinical practice. Are we clear so far? Are we clear so far?
It's clear, but the volume is just too low.
Try and increase the volume on your device. My volume here is quite high. Okay, so I was saying clinical ethics.
Your voice is just too low. I don't know if it's your voice or something.
I'm saying try and increase the volume on your device.
I have increased the volume, but it's still low.
Probably the network is affecting the presentation.
Huh?
I think the network is also affecting the presentation.
Okay.
Okay, so I was saying clinical ethics are basically rules and regulations that provide you with a way of identifying, analyzing, and resolving ethical issues in clinical practice. So whenever a doctor, a nurse, a clinician is faced with a difficult problem between the health professional and the patient, okay, the structured approach that may help them in solving that problem is what is referred to as clinical ethics. Okay, and then secondly, we're talking about principles of clinical ethics. These principles, I believe, have already been explained in one of our previous sessions. We talked about the principle of respect for autonomy. We talked about the principle of justice. We talked about beneficence. And lastly, we talked about the principle of non-maleficence. If you have been following our slides previously, we had talked about the principles of medical ethics. In other words, they are the principles of clinical ethics. Okay, so thirdly, today we're going to look at another topic called medical jargon. Okay, so we're just going to define what medical jargon is so that we can have a basic understanding of what this word refers to or what it means. Okay, so the definition of medical jargon says medical jargon refers to structured vocabularies covering complex concepts such as diagnostic tools, diseases, operations, treatments, and medications. In other words, we are saying medical jargon refers to terminologies commonly used among health professionals in clinical practice. In a layman's language, jargon means a language. It means a vocabulary. It means uh, a structured way of communicating. Okay, so we're saying in medicine, there is a jargon, there is a language that is used. So basically, when a doctor is telling another doctor the problem that a patient has, there is a scientific way of explaining the problem. Okay, so we're saying the language that doctors, clinical officers, nurses, and other health professionals use, the language or the terminologies that they use to explain diagnostic tools, diseases, operations, medicines, and treatments, that is what we call jargon. The question comes to say, define medical jargon. I expect you to write words like terminologies commonly used among health professionals. in clinical practice. Are we together so far? Are we together so far? Anyone who's able to hear me?
Yes, and we're together.
Okay. So we proceed. Our next topic is called deontology. Okay, so we're going to look at the definition and also other aspects regarding deontology. So this concept or this study, which is deontology, was actually coined by someone called Kant. Okay, so the author of deontology is someone who was called Kant. So this one says deontological ethics refer to a system of ethics that judges whether an action is right or wrong on a moral code basis without considering the consequences of that action. Okay, we are saying this ethics system is intended to be precise and by the book. What this means is that in deontology, a clinical officer, a nurse, any medical professional is expected to, to choose a course of action that is prescribed in any book. Okay, it does not matter what people will think, it does not matter the consequences. What matters is that the professional has followed what is written. So if your ethics are saying this should not be treated, it means under deontology you are expected not to treat it. Okay, so people that follow this theory of deontology actually follow the principles that are stated clearly in the book, the way they are stated. Okay, further we are saying the deontological system states that doing the right thing means following proper rules of behavior and by so doing promoting fairness and equality. Okay, the reason why deontology focuses on following the exact rules is because the same way you follow the rules in dealing with one's problem, that is how you follow them in dealing with another person's problem. Okay, so there's no difference in the way you tackle problems. There's fairness and there's equality if you are following the theory of deontology. That's basically what it means. So in the examination, should you be asked to define or write short notes about deontology, you are expected to state that the system of deontology or the deontological ethics refer to a system of ethics that judges whether an action is right or wrong, depending on a moral code. Okay, this system does not consider the consequences of that action. We're saying deontology works well in theory, but in reality, it is quite difficult to comply with it. What this means is that it is very easy to follow books on paper. In theory, it is easy to follow this concept. But when we come to reality, there's a problem here because uh, one is uh, one is expected to reason, one is expected to be a little kind. This is what religions preach. So I think in reality, it is difficult to comply with deontology, but in theory, it is quite easy. Okay, we're saying questions that may be asked and cannot be answered using the theory or ethics in deontology. For example, what happens when you have to choose between two evils? What this means is that what happens when the only way of saving an individual is by you choosing between this lie and that lie. I'm sure you've heard the norm of saying the better lie or the good lie. Okay, what will happen when you have to lie in order to save a soul? So in this case, deontology will tell you you should not lie. You should speak the truth, even if somebody has to die, regardless of what will come, the consequence or the outcome. Deontology says you must follow the truth. You must do the right. Secondly, we're saying what happens when the situation is not black and white. When we say right and wrong, we basically mean a black and white situation where you have to choose between right and wrong only. But what happens when the situation has no right? Both options are wrong and you still have to choose one. What happens in this case? Then thirdly, we're saying what happens when you cannot be objective. The essence of choosing the right thing is so that you can achieve something in the end. But what happens when, regardless of what you choose, the outcome may be bad? Okay, so we're saying the theory of, or the ethics in deontology explain that an individual should choose the right action no matter the consequences. Are we clear about that one? Are we clear on that one?
Sir,
Yes,
kindly
sir, we are
explain in
clear.
the questions, the second one. What happens when the situation is not black and white?
Black and white can mean right and wrong. Okay. So now, for instance, okay, there's a question in the other slide. So when we look at that question, I'll be able to explain the meaning of black and white. Okay, but basically it refers
Okay.
to right and wrong. What happens if in your situation you must choose between two wrongs? That's what we're trying to say. Deontology talks about only two options, right and wrong. Now, what happens if the situation requires you to choose between wrongs only? That is what we mean by the situation is not black and white. Okay, so further we're going to look at another system of ethics, which is called utilitarianism. Okay, so this one was coined by someone called Jerem Bentham. Okay, so Jerem Bentham is the author of utilitarianism. Under this one, what we are saying is that utilitarian ethics state that a course of action should be taken uh, by taking into consideration the most positive outcome. So Bentham defines utility as the aggregate pleasure after deducting the suffering of all involved in an action. Let me just take time to explain what this means. Since under deontology we said an individual is expected to choose an action which is right. Okay, you are not expected to do wrong, you're expected to choose the right action because that is what your rules are saying. But under utilitarianism, we are saying an individual is expected to take a course of action depending on the most positive outcome. What that means is that you need to look at what you want to achieve. This is objective. You need to look at the situation ahead. What is it that I want to do? If what you want to do is good, utilitarianism does not focus on your course of action. Sometimes you may have to do bad things. For instance, you may have to tell a lie for you to achieve something good. Under utilitarianism, it is okay because despite you having lied, the result was good. So what we're saying is that deontology says you don't have to lie, you must speak the truth. Utilitarianism is saying it doesn't matter if you lie as long as the outcome is positive. Okay, the utilitarian ethics system is more accurate in addressing complicated moral situations. However, it is not justice oriented. So now we are saying to differentiate deontology and utilitarianism, moral dilemmas are used. What is a moral dilemma? This is more like a circumstance or a situation in which one is urgently required to make a decision, mostly between right and wrong or between wrong and wrong. Okay, moral dilemmas are just situations in which one must immediately make a decision. Okay, so what we're saying is that the basic difference between utilitarianism and deontology is depending on the moral dilemma that has been used. So to find out how these two differ, you are required to use a moral dilemma. Are you able to hear me? Are you able to hear me?
Yes, sir, I can hear you, but can you kindly explain more about moral dilemma?
So I want to give you an example of the moral dilemma so that you can understand it.
Okay, sir.
So this scenario is saying Peter, 44 means Peter is 44 years old. So we're saying Peter, 44, takes his sick son to see a doctor and finds out that his son needed a very expensive surgery. Peter has no time to raise this amount. Meanwhile, his son is in a critical condition. So desperate to save his son, Peter gets a loan from a bank in the name of establishing a business that will generate a lot of revenue. Peter pays at the hospital, the surgery is done, and he saves his son's life. Are you able to hear the story?
Yes, sir.
Yes.
So we are saying, according to Kant's deontology, Peter should not have lied to the bank. But according to Bentham's utilitarianism, Peter did the right thing because in the end, he saved a life. Are we clear on this one?
Yes, sir.
Yes, sir.
Peter told lies to the bank so that they can give him a loan. If he said, I want to save my son, the bank would have said no. But he used a business to gain a loan from the bank. And when he got the loan, he paid at the hospital and the son was saved. So now deontology is explaining to Peter to say you should not have told lies to the bank. It is wrong to tell lies. But utilitarianism is telling Peter to say you did the right thing because in the end you saved life. Okay, so in explaining this, what we mean is that deontology is good because it follows the book, but it may not be applicable in reality. In this case, Peter is a parent, and the one that is sick is his only son. He has no wife. He cannot allow his son to die. He has to do whatever it takes as a parent to save the life of his son. Okay, so under utilitarianism, Peter told lies so that he could save his son. So utilitarianism says it is okay to use a wrong method to produce a positive outcome. But under deontology, we are saying it is not okay to tell lies even if the outcome is positive. Are we clear? Are we clear?
Yes.
So the
Yes,
story
sir. We are clear. I'm clear.
the story or scenario I just gave you is what we call a moral dilemma. A situation in which someone has to make a decision. That is what we call a moral dilemma. So to sum this, we're saying in reality, ethical dilemmas are not easy to solve because ethics depend on a moral framework. We make decisions based on what we believe and what is best for us, but not necessarily for everyone else. In some situations, we decide with our hearts, while in other situations, we decide with our brains. A simple quotation under this one says, being human is part of the dilemma. This was coined by Jeremy Bentham. He says, being human is part of the moral dilemma. So we proceed. Next, we're looking at a topic called virtue ethics. So we have looked at clinical ethics, we have looked at deontology, we have looked at utilitarianism. Now we are looking at virtue ethics.
Yes, sir. I'm getting you. Yes, sir.
So under virtue ethics, we are saying virtue ethics are theories that emphasize the role of one's character and sense of honesty in moral philosophy, rather than doing one's duty or acting to bring about good consequences. So what we mean by this is that in deontology, you need to do your duty, you need to do what is right. In utilitarianism, you need to make sure the outcome is good, the consequence is positive. But under virtue ethics, we are saying as a human being, you must make a decision depending on your character. It means that what you do explains your character. Who you are can influence the decisions that you make. So we're saying virtue ethics acknowledge how the character or honesty of a human being can affect or influence their decisions. Okay, a young man, a philosopher, rather an old man, a philosopher called Aristotle, in his time defined a virtuous person as someone who has ideal character traits from natural internal tendencies, nurtured, established, and stable. What Aristotle is trying to say is that for you to say a person is virtuous, it means they have certain traits, certain qualities that makes their character good, and these things are something they do often. It's in them. That is how they are nurtured. It's something that is established in them. It is something stable. For instance, in religion, you would say a religious man is not supposed to commit a sin. Okay, so what this means is that among the virtues of a religious man, sin should not be there. So you do not expect a religious man to sin in any situation because that is the behavior of a religious man. So virtue ethics simply state that your character, your behavior has a role to play in the decisions that you make. Okay, so we're saying the application of virtue ethics focuses on answering questions to do with how one should live, proper social and family values, and the meaning of a good life. What this means is that under virtue ethics, the way you are taught at home, the values your family has, the way your society handles you, and who you think leads a good life, the example of a good life to you can all affect the decisions that you make in life. Okay. However, virtue ethics also have criticisms. They have been criticized. The first sentence here states that virtue ethics do not exceed self to tackle how one's actions affect other people. What this means is that because people depend on their character to make decisions, sometimes they forget how their character affects other people. Further, we are saying virtue ethics depend on the lack of one growing up to be honest and of good character, neglecting the influence of education, technology, and society on upbringing. What this means is that since virtue ethics depend on your behavior being good or your character being good, virtue ethics do not recognize the influence of education. Sometimes even a good person, if educated, may end up to make wrong decisions. Okay, because of technology, children may end up abusing social media. Because of the society in which someone grows up, one may end up being a drunkard, a drug addict, even though in their childhood they used to be good people. So we are saying we cannot entrust this decision making only to virtue ethics because they are not enough. Because again, virtue ethics do not clearly explain the exact way someone should behave. In virtue ethics, a common sentence states that an individual should act the way a virtuous person would act. But then the question is, how do you know how a virtuous person would act? Because they will not tell you to say, Chanda behave like John, Jane behave like Mary. You see, they expect you to just guess how a virtuous person will behave. Someone, if for instance, you're asking your friend the question, you say, my friend, this is what I'm going through. How can I do to get out of this? Then your friend says, I don't know, just think of what a Christian would do. Think of what a Hindu would do to get out of that situation. Okay, it means you are left to imagine, you are left to just think of what someone would do, someone who is virtuous would do to come out of that situation. So virtue ethics may be good, but they are not enough because they depend on luck. They depend on whether your family brought you up well or not. They forget that even an individual who was brought up very well can actually change the way they behave because of peer pressure, because of social influence, because of education, because of technology. Are we together this far?
Yes.
Yes, sir.
Yes, sir.
Okay, so we proceed. We go to the next topic, which is almost our last topic for the day. So under this one, we're talking about a multidisciplinary healthcare team, an MDT. So we're saying a multidisciplinary healthcare team involves a wide range of health professionals from one or more organizations working together to deliver comprehensive patient care. What we are saying is that a multidisciplinary healthcare team is a group of people who all belong to the health profession from either one organization or from two organizations. These people come together and join their services so that they can deliver effective and efficient comprehensive patient care. So the functions of a multidisciplinary healthcare team. The first one says the multidisciplinary team addresses concerns and answers questions from patients and their families about their well-being and about their health. Okay, so we are saying this team helps patients to manage their own health by discussing nutrition and hygiene. Further, we are saying the team diagnoses and treats illnesses and injuries. And then the team further ensures the delivery of efficient and effective patient care services to enhance or promote patient satisfaction, recovery, and reintegration into society. The team promotes job satisfaction, delegation, and interaction among healthcare professionals. So I'll just take time to explain the functions of this team. What we're saying is that these are people that belong to different health sectors, but they are all in the health profession. So now when these people come together and form a team, each of them has something different to do to contribute to the team. However, the ultimate goal of this team is to make sure that they diagnose and treat illnesses and injuries. Now, in doing this, they bring different people together so that the services can be efficient and the services can be effective. Patients can be satisfied and taken back into their societies. They also make sure that as they work together, they promote interactions, socialization, and job satisfaction amongst them. Okay. So now this group, someone may ask, who are the members of a multidisciplinary healthcare team? Okay, so to begin with, we have psychiatrists in the team, we have doctors, under doctors, we have medical doctors, and we have surgical doctors. Okay, and then further, we have clinical nurses or community mental health nurses. And then further, we have social workers. These ones can do counseling services, they can do advocacy services. And then we have other therapists. So we can have clinical generals in the healthcare team. These people will help us with the services that are needed to be provided at the clinic level. Okay, for instance, so when we don't have a community mental health nurse, we can use a clinical officer psychiatry to provide similar services. And then under the topic of other therapists, we have occupational therapists, we have physiotherapists, we have art therapists, drama therapists, we have laughter therapists. So these are kinds of people that can help us with providing a different kind of therapy that doctors and psychiatrists may not be able to provide. For example, those that do art or drama therapy, those that take patients into things like music therapy. Okay, so there are also like physiotherapists, those that have to deal with the bones and dislocations in the body. So all these different types of therapists can be members, but the more basic members are psychiatrists, medical and surgical doctors, clinical officers, clinical nurses, community mental health nurses, social workers, occupational therapists, counselors, psychologists, pharmacists, and we have medical secretaries. Okay, so if a question comes in the exam to say, define an MDT or a multidisciplinary healthcare team, the definition has been given to you. And then another question may come to say, explain the functions of an MDT. The functions have been highlighted. Then lastly, a question may come to say, explain or list at least 6 members of a multidisciplinary healthcare team, or list at least 8 members. So you are required to pick from the list that has been given to you. Tamfika.
Yes.
Tamfika.
Tamfika sawa.
So basically, these are the things I wanted us to look at for today.